Hi Sharon, my name is Erica. I'm going to be your nurse today. I'm just gonna hand you an assessment on you, a postpartum assessment. Are you okay if I have your family leave the room while I do this? Yeah, okay. So I'll just have you guys just go out this door and just go into the lobby waiting area. And then I'll bring you guys back in. Thank you guys. All right, so I'm gonna sanitize my hands. I've got my computer loaded. I'm gonna scan your wristband, or gonna check your wristband. Okay, can you state your name and date of birth for me? Perfect. That matches with my MAR. All right, so I'm going to go ahead and raise your bed to a comfortable working height for me. How are you feeling today? Good. Perfect. Okay, I'm going to go ahead and listen to your heart and lungs and make sure that's all sounding good. I'm also going to get your blood pressure, your temperature, your pulse rate, your respirations, and your O2 stats. So I'm going to take a listen. Just breathe normally for me. Just going to listen to your heart here first. Okay, your heart sounds good. Now just take some deep breaths for me, okay? Okay, good. And then I would check in the back for your lungs. Any pain while breathing? No? Okay, that's good. Do you have pain anywhere else? Not currently? Okay. If you did have pain, I would assess the characteristics of your pain, the onset of your pain, the location of your pain, the duration of your pain, exacerbation if anything makes it worse, if there's any radiating pain, or if there's any kind of relief that makes it better. So now I'm gonna go ahead and get some gloves on and do an assessment. I'm just gonna fill the top of your uterus to make sure it's firm, and I'm gonna try to fill the location of your uterus and the height of it. All right, perfect. I'm just gonna pull up your gown here, okay? I'm still giving you some privacy. Okay. All right, I'm just gonna put some gentle pressure here, okay? I'm gonna put one hand on the symphysis pubis and one hand right here. I'm just noting where it is. It's 2 finger lengths below your umbilicus. And it's firm, which is good. If it was boggy or soft, then I would do the crudé maneuver. But yours is firm, so that's good. I don't see any distension in the stomach. That can mean some kind of bladder issue. Let's see, have you been able to pass any gas or have a bowel movement since giving birth? Okay, that's good. I'm just gonna take a listen to your bowel sounds and make sure that's good. Okay, that sounds good. Hypoactive bowel sounds. There's no pain or tenderness when I press there. Just a little bit. Okay, that's normal for just giving birth. Now I'm gonna move down to the lower area. Are you okay if I check your pad and help you down there? Okay. All right. So I'm noting any odor, the clots, hemorrhaging. I'm noting any of the odor and the amount of blood that has been lost, which is normal to have some blood loss after birth, but we want to monitor that. I'm just going to set this aside and we're going to go ahead and weigh it, just to see how much you've lost. I don't see any, there's a little bit of redness, which is normal. The approximation is good. There's no hemorrhoids or ecchymosis. I don't see any drainage, so that's good. I'm gonna cover you back up here for a second, and I'm gonna go ahead and help you with some, change my gloves. I'm gonna help you do some self-care down there. I'm gonna get you a new pad and everything for you. Do you have any pain while urinating? No? Okay, that's a good thing. I didn't see any tearing that you had or anything. Sorry. Alright, I'm gonna go ahead and grab a kit here. Are you able to see me okay from right here? Perfect. Okay, so I have this fancy little kit here. What we're gonna do is we're gonna take an ice pack, and then we're going to take some Hazel Witch pads. So these are, it's a cooling system that soothes. It's gonna help relieve some of that discomfort that you're having. You just kind of want to layer it on there. You don't need too many. And then I'm gonna take some of this ointment right here. It'll help with some of the itching and the pain. You just kind of want to put it in a little layer all across here. And I forgot to put the pad on. You put the pad on first. And then, so I'm just gonna kind of transfer these little guys over here. Sorry about that. dermoplast. This will help with the pain and itchiness. So you can either spray it topically on yourself, or I can just go ahead and spray it on your pad, whichever you would like. Spray it on the pad, okay. All right. And then would you like some help getting this pad on? Yeah, okay. All right. So, just gonna lift this up. So, help with that pain pretty soon. And discomfort. So that's one of the things that you can do for pain. You can also, for pain, you can also deep breathe, and you can cough. I'm going to change my gloves here again. But you can turn your head and cough. That will help with the pneumonia, so you don't get that. Another thing here you can use is just some peri-wash. So it's just filled with some warm water, and you can just spray it when you go to the bathroom and pat it dry. And that way you don't have to wipe and cause any kind of irritation or anything like that. So that's another thing that you can do for pain and comfort, alleviating that. Alright, so I'm going to go ahead and move this out of the way for a second. I'm going to grab some gloves again. Looks like we ran out of some small gloves, so I will put some medium gloves on over here. Alright, so now I'm just going to check for clonus. Clonus is where I'm going to, I'm just going to lift up the sheets here. I'm just going to press on your feet and just let them relax. Okay, that looks good. If there was a problem, that could be a sign of eclampsia, where your feet just kind of flutter down. Which I don't see any of that, so that's good. I'm also gonna, while I'm here, I'm gonna check for edema or any swelling, which that all seems really good right now. It looks like those SCDs are helping, which we put these SCDs on after a C-section or after you've had spinal anesthesia, which you have had, so we do need to keep those on there until you can ambulate. Let's see, I'm going to go ahead and check your IV here. I'm looking for patency and any kind of infiltration, redness, coolness. I'm not seeing any of that, or phlebitis or anything. Not seeing that, so that's good. It looks like we got the correct flow rate going and the correct solution, which is good. I'm gonna come over here and just check your catheter, and the color looks good. You're hydrated, which is fantastic. There's no bad odor or anything. The color's good. And there's a good amount of urine coming from the bladder, so that's a good thing as well. And then, is there any cultural practices that I need to know about? No, not at this time. Okay, that's perfect. And I've noticed that you are doing really well. communicating with your family, and it seems like you're doing well with your baby as well. One last thing here, I'm gonna check your breast, is that okay? Alright, so I'm just looking for any kind of redness or swelling, any drainage from the nipples. I'm looking for whether they're inverted or exverted, which that looks good. They're in the correct position. Has your baby had any kind of troubles latching? No? Okay. Any audible swallowing? Okay. Let's see. Now, I'm just going to check your incision site here after the C-section. So it looks good. There's no drainage, which is good. It is a little bit of red, which is normal for having a C-section. Is there any pain right there? No? Okay. All right. Just a few more things. Some reasons why you would have a C-section is your pelvis may not be the right size, or your baby has had some kind of fetal distress, or the heart rate's dropping when it's not supposed to, or it could also just be the lack of progress in dilating, which it looks like that's what happened. So you started out here and then you had a C-section, which is not all that uncommon. So I told you how you could alleviate some of that pain, and we can alleviate some of that swelling. Duromorph is a pain medication, so we do have to check your respirations and your oxygen periodically every 15 to 30 minutes. So I've got a pulse ox on your finger right now, and I'll come check on that, and then I'll also check your respirations and make sure you're not having any kind of respiratory distress. I can also give you some antihistamines for the itching from the Duromorph. Itching is a normal sign when you're taking Duromorph. Another thing you can do for pain is we can give you ketorolac or some kind of pain medication. But everything looks good and on my end, and I checked your IV site and your abdomen, and I checked the cervix or the uterus and the bleeding, and it all checks out. So I will go ahead and let your family know that they can come back in, and I'll get you back down. You lower your head back, or your bed back down. Do you have any questions for me?